Assalamu alaikum. I'm Dr. Muhammad Ali Rabbani. I'm Part 2 resident of FCPS Anatomy, and today on the forum of Medicose Academics, we are going to discuss general anatomy of joints. In this lecture, by the end of this, you should be able to classify joints with example of each, describe the structure of a typical synovial joint, and enumerate the factors that affect the stability of a joint. We will also discuss the Hilton's law and how to define it. Joint is any point where two or more bones meet. It's also known as articulation. Its definition is as simple as that. Let's discuss a little bit about the classification of the joint. I have made a flowchart describing all of the steps in the defining. We'll see that shortly. So let's take it from the top. Any point where two or more bones meet is known as a joint. It is further divided into synarthrosis, diarthrosis, and that is further divided in different steps. Rather than going into the detail in this particular slide, let's move on. This is the ultimate target that we must achieve by the end of this lecture. I should gradually build up this table as we move along the lecture. Normally, the questions in the UHS especially are asked, there are very few questions asked from the fibrous joints. It is been asked about their definition, their classification, and the type of the sutures. We will discuss them. There have not been recorded SEQs from the cartilaginous joint, although there can be MCQs and in the Viva question, and this diarthrosis. This can be singled out as the one of the most important topic of the general anatomy that is asked in the short essay questions in UHS. The questions are all about all the aspects, but in decreasing frequency. Most of them are asked about the classification according to shape. Next come the movement, and next come the complexity. We will discuss the questions one and one. Okay, let's start from the beginning. Overall joints, they can be divided into two parts by depending upon the presence or absence of the cavity between them. If there is a cavity between them, these are known as diarthrosis or cavitated joint. If there is no cavity between them, these are known as synarthrosis or solid joints. So we are on the first layer of our classification, diarthrosis and synarthrosis. Let's explore further the synarthrosis. So here you can see a simple diagram differentiating between synarthrosis and diarthrosis. Here you can see that it is a cavitated joint, diarthrosis, it is a solid joint, synarthrosis. Synarthrosis. These are the solid non-cavitated joints. If they are non-cavitated, this means that the two ends of the bones must be held together by some material. If the bones are not held together by any secondary material, if there is a bone between them, then it would not have been a joint. So it must have been held by some material, and depending upon that material, they are divided into further two types. So they are known as fibrous joints if the bones are held together by fibrous tissue, or cartilaginous joint depending upon if they are joined together by cartilage. So there we go to the next step, fibrous joint and cartilaginous joint. Let's discuss them one by one. Fibrous joint, as the name indicates, their articulating surfaces are joined by fibrous tissue. They are further divided into three types depending upon the shape of the bone which join them. And they are sutures. Sutures are mostly the bones joined between the bones of the skull. There is a very limited amount of connective tissue. The bones are very close to one another. They are reciprocal in shape, and there are very small amount of fibrous tissue in them. We will go into the detail a little bit in the next slide. Then there is syndesmoses. The bones are not especially joined well together. They may have a gap between them, and they have fibrous tissue between them in the form of ligaments or plates of ligament or cords of ligament. For example, the radio ulna has interosseous membrane between them. Same goes for tibia and fibula in the lower limb. And then Gomphoses. These are known as packed of one bone fits into the socket of other. This is the specific type of joint that is named for the joint between the bone of the jaw and the teeth, root of the teeth and alveolar sockets as we call them. So here are the three shown here. Sutures, reciprocally shaped bone with minimal amount of tissue. Syndesmoses, bones further apart from each other with interosseous membranes or ligaments. And Gomphoses, peg of the root of the tooth in the socket of the alveolar bone. Fibrous joint, we will discuss sutures a little bit more in detail. They are divided into further types depending upon the shape. There are serrate sutures. Serrate sutures are the one where the reciprocal surfaces are tooth-like. Like here is the bone, it has a shape like this, and it is joined by the other bone. So as the shape joining them is tooth saw-like, it is known as serrate suture. A common example is sagittal suture. Then there is denticulate suture. Name gives away that the two bones are joined together by tooth-like reciprocal shape. So it will be like this. So they will be like this, and the two bones that are joined together by tooth-like lambdoid suture of the skull is an example. Then there is squamous suture. Squamous suture, if we look from above, we can see that they are like this. Simply we can see a line between them. But if we let's go here. But if we look from the cut section, if we look from here from the side, let's see here. If we look from the side, we see that one of the bone, it is like beveled surface. Beveled surface means that is it tapers into a tip like that of a knife, and the other bones does the same. So they are like the beveled surfaces are reciprocally um, overlying each other. So it's like an edge of a knife lying on top of edge of another knife. So these are like this. So this is reciprocally beveled, and a very good example is temporoparietal joint that is on the side of your skull. Then there are plane suture. Name indicates that the flat surfaces, if we see from the top, it's again like this, just like squamous suture. But if we see from the side, they're not like this. If we see from the side, if we see the cut section, they're simply the two flat surfaces of the bones are joining each other. So these are the different types of the sutures that have been asked in the question sometimes. So let's review the exam questions that have been asked regarding these topics. Define the fibrous joint. I hope you can define it now, and classify, give their classification with one example of each type. It has been asked in consecutive years in UHS. Name at least three types of sutures with one example of each. I hope you can answer to this question also now. So we are done with fibrous joint variety of the synarthrosis. Let's move on to the next variety. The cartilaginous joints, when the two bones are united to each other by a cartilage, that is considered to be a cartilaginous joint. This is further divided into primary cartilaginous joint and secondary cartilaginous joint. For the purpose of Viva, you should know their alternate names. Primary cartilaginous joints are known as synchondroses, and secondary cartilaginous joints are known as symphyses. Synchondroses, primary cartilaginous joint, it is there the bones are united by a plate of hyaline cartilage. There is a bone on one side, there is a bone on other side, and in between there is hyaline cartilage and nothing else. It has two specific characteristics. One, the primary cartilaginous joint does not allow movement to be done here. There are no movements at primary cartilaginous joints. The second thing is that the primary cartilaginous joint usually ossifies with the advancing age, and when it ossifies, it disappears, and the two bones that were originally joined by that bone become one bone. I'll give you an example. For example, when you are growing in length, the part of the joint that is between the epiphysis, that is end of the bone, and metaphysis, that is tapering part of the shaft of the bone, that is known as, here you can see there is epiphyseal plate, epiphyseal cartilage, that can be, in anatomical terms, it is actually defined as cartilage, because epiphysis for all the practical purposes is a separate bone as the diaphysis, from the diaphysis, and there between them is a cartilage. But as we grow old, the epiphyseal joints they disappear, and the epiphysis and diaphysis they join together to form a single common bone. And these are the two basic things about primary cartilaginous joint. And other example is this first joint, This is asked in the relation to the gross anatomy of thorax, that is the joint between the first rib and the manubrium. There is no movement there, it ossifies with the age. Let's move on to the secondary cartilaginous joint. Again, the bone are joined by cartilage, but now there are two types of cartilage involved. Let's see. There are two bones. Let's say have to make joint with one another. Between them, there won't be simply a one cartilage. The surfaces of the bones have haline cartilage, like this, like this. Again, but these two haline cartilages are not joined directly with one another. But the two haline cartilages, they are joined together by fibrocartilages. So here you can see that two types of cartilages join the bones. First, the surfaces of the bones are joined to covered by haline cartilage. Here you can see this one and this one, and then in between them there is fibrocartilage. So these are the symphysis or secondary cartilaginous joint. Slight degree of movement is possible. In some cases, like an intervertebral disc, there is a higher degree of movement, and their example includes, interestingly enough, most of them are present in the midline. So the examples include pubic symphysis, that is present between the pubic bone here. Let me okay then examples include pubic symphysis and the disc between the intervertebral joints, that are intervertebral joints, and then there is the. So we are done with non-cavitated joints known as synarthrosis. I hope you got something from it. Moving on. Diarthroses are known as synovial joints. They are cavitated, and due to that they permit free movement between the bones. They can be classified by three different definitions, and they can be classified according to the complexity, according to their freedom of movement, according to shape of articulating surfaces. Let's go them one by one. Complexity of the bone. If the two points, they can be divided into simple, complex, and compound. There's slight difference, but it is important that you get them. A simple joint is that two bones make joint with one another, but there are no more than two bones, and there is nothing between the two bones. By nothing, I mean there is no interarticular disc or meniscus. Most of the joint are in this variety. Shoulder joint is one of the example. Compound joint is one when there are more than two bones involved. So here you can see that in elbow joint, above there is humerus, below there is radius and ulna. So it is a compound joint where there are more than two bones involved. For in the lower limb, there is knee, femur, tibia, and patella. Three bones are involved. That is compound joint. Now then there is complex joint. It is a little bit different. Complex joint does not have anything to do with the number of the bones. Complex joint says that between two articulating surfaces there is something else. This something else can be an articulating disc, or it can be a meniscus. For example, in knee joint there is meniscus, sternoclavicular, acromiclavicular joint, there are disc, in wrist joint there is intra-articular cartilage. There is something within the cavity that is between the two surfaces of the opposing bones. A joint can be complex and compound at the same time. For example, a knee joint is compound because it is made up of femur, tibia, and patella, and complex because it contains medial and lateral menisci at the same time. Let's review exam question. Define complex joint. I hope you can define it. Mention three examples from upper limb. I just gave you four examples in the last slide. What is the difference between complex and compound joint? Now you must be very clear about their definition, and you must be clear that they are not mutually exclusive. A joint can be both complex and compound. So we have done with complexity. Let's move on. Let's discuss the freedom of movement. If a joint moves around only one axis, it's uniaxial joint. For example, interphalangeal joint only does flexion and extension around the transverse axis. Similarly, atlantoaxial joint does only rotation around vertical axis. So the movement is around one axis. Biaxial joint, the movement is around two principal axes. For example, wrist joint does flexion and extension around horizontal yet transverse axis, and it does adduction and abduction around the anteroposterior axis. Multiaxial joint, it involves the movement around all three axes. A very good example is shoulder joint. Around the horizontal or transverse axis, there is flexion and extension. Around the anteroposterior axis, there is adduction and abduction, and around the vertical axis, there is internal rotation and external rotation. So here you can see very well example of uniaxial elbow, biaxial. You can see here the joint of metacarpophalangeal, and multiaxial. You can see the example of shoulder joint. So we're done with classification of joint according to the movement. Now, the classification of the joint according to the shape of the articulating substances. This is almost the exclusive or the most important question that is asked regarding the joints. And often this question is merged with the biaxial and uniaxial that joint. We will look at the examples just now. On the basis of the shape of the articulating surface, joints can be classified as follows. We will go through them one by one. This is a beautiful picture from the Moore's Clinical Oriented Anatomy. I have given the references of all the pictures I have used at the bottom of the page. You can see throughout. Let's go through them one by one. Joint. Plane joint are the ones where the opposing surfaces are plane, simple as that. And when they are plane and they glide across each other, usually gliding movement is possible. Okay, one thing about UHS is that they usually ask examples from both upper limb or lower limb, or they specify that give an example from upper limb or give an example from lower limb. So for each variety of the joint, be very vigilant to memorize at least one example from both the limbs. So here you can see that the articulating processes of vertebra. There is intermetatarsal joint, the joint between some of the carpal bones, joint between some of the tarsal bones. Simple gliding movement like that can be possible between the bones like this. So these are plane joints. Hinge joints. Hinge joints are like the hinges of your door, and there is along one axis there is only uniaxial movement is possible. So where is the axis? So this is the axis around here. You can see now this is the axis that has been passing from this, and this is the movement that occurs between them. So hinge joints are uniaxial joints, and they permit movement in one direction only, that is flexion and extension mostly. So there is knee joint, there is elbow joint is the textbook example, and even the interphalangeal joints of the hand and foot are that example. Moving on to the atlantoaxial joint, it is a joint between first and second vertebra. You will learn them in detail in the second year of MBBS, sometimes also known as trochoid joint, and it permits there is a vertical axis. There is only one axis, uniaxial joint. Here is a vertical axis, and the movement is around that axis. So there is a rotatory movement possible around that axis. So in case of radius and in case of atlantoaxial joints, this pillar or axis it remains, and the socket above it rotates in case of atlantoaxial joint, and the similar joint is present at the case of radioulnar joint. In that case, the axis that is of the head of the radius it rotates. Ellipsoidal joint, a condylar joint, also known as ellipsoidal joint. Here, the articulating surfaces that oppose one another are almost oval in shape, and due to the oval nature, the movement is possible in two directions. So it is biaxial joint. So it can produce flexion, extension, adduction, and abduction, but do not allow rotation. And when there is flexion, extension, adduction, abduction present, we can do circumduction, but rotation is not possible. So they are also known as ellipsoidal joint, and when some joints have two condyles, they are known as bicondylar joint. For example, knee, there are two condyles, each of them is oval in shape, so there are two condylar joints together, they are known as bicondylar joint. Similar example is that of the jaw. Temporomandibular joint, on each side of the face there is one part of the joint that is known as bicondylar joint. Then there is saddle. It's like the saddle of the horse. It the special thing about it is that in one direction it is concave like this, in other direction it is convex. So it is concave in one direction and convex in other direction, and the reciprocal curvatures are present on the other bone. So this particular bone is biaxial, only flexion, extension, adduction, abduction are possible, and there is no possibility of rotation. A very good example is ankle joint, calcaneocuboid joint present in the foot, and the textbook example is that of the joint between trapezium and first metacarpal, that is at the base of the thumb. Hip joint, shoulder joint, also known as glenohumeral joint, there's spheroidal joint. There's a cup-shaped socket, and there is a ball inside that socket, and it can move around all three axes, providing flexion, extension, adduction, abduction, and uh, internal and external rotation. So this is all about the classification of joints on the basis of their shape and the movements that are possible in them. So we are done with classification of the joints. Let's review exam questions. I will not be giving them detailed answer, but we have seen them. Let's go through them. Classify biaxial joints. We did that. Write a short note on ellipsoidal variety. We saw that condylar variety. You can give the axes, their movements, and their examples. Explain the movements of uniaxial complex joint of upper limb, which has pivotal structure appearance. Now, a lot of information given. What is uniaxial complex joint? There is one uniaxial complex joint which is pivot structural appearance. So there it is talking about elbow. So give a detail about that. Why screw, nut, and bolts are tightened with right hand in all persons, irrespective if a person is right-handed or left-handed. The answer to it is that the supination action is more powerful than pronation. So when you tighten the screw with right hand, you supinate, but when you tighten the screw with left hand, you pronate. Even if a person is left-handed, supination is more powerful. So even a person is left-handed, he will prefer to tighten the screw or a tab from the right hand because it will involve the supination of that hand. Right? Four anatomical features of hinge joint. We discussed that uniaxial, two types of movement. There is shape. There is a cylinder like ball, and then there is socket, and there is cylinder of pivot in them. You can give the examples of that. What are named the movements permitted, and quoted two joints with their common axis of movements. Two joints you can discuss about interphalangeal joint, you can discuss about elbow joint. In tabulated form, classify synovial joint according to the arrangement of articulating surfaces and quote one example each from the limbs. So this is the whole of the discussion of all the classification that we did in the basis of the shape of the bones. At four anatomical features of hinge joint, don't forget to read hinge joints in detail and any two example of hinge joint present in the limbs and name the movements permitted in the quoted two joints with the common axis of movement. What is ellipsoidal joint? What are the movements possible at ellipsoidal joint? Two movements are possible or around two axes, and give an example of joint from upper limb, that is the joint at the base of the thumb. Let's discuss the structure of a typical synovial joint. A typical synovial joint consists of the following parts. First, the two bones, the articulating surfaces are facing each other. Both of them contain this cartilage that is covering the bones. So this is known as articulating cartilage. Inside the capsule, the part of the capsule that is not covering the articulating surfaces, it is covered by this synovial membrane. It provides a smooth surface for the friction against the capsule, and it is also responsible for the production of the synovial fluid. Then whole of the cavity is filled with the liquid that is known as synovial fluid. And synovial fluid, its functions are sometimes asked that it lubricates the joint, it gives the nutrient, and it provides a medium for exchange for the waste material also. Outside the synovial joint, there is capsule. It covers the joint, it gives them strength. And then there is, in the case of complex joint, And there is outside there may be ligaments. We'll discuss them in gross anatomy. In complex joint, you can see that there may be articulating discs or menisci. It's the knee joint, so we'll discuss meniscus here. And a labrum. Labrum, they are present in the glenoid cavity, that is in the shoulder joint, and in the acetabulum, that is in the hip joint. The socket, if the socket, bony socket is in this much, and here is the bone going up, additional part, additional cartilage, it is present around the margins that deepens the socket, and it makes the joint stable. And then there are fatty pads. You can see the rest of the irregular surfaces are filled with fatty pads. So these are all the structures that are present in a joint. Remember them, and it is a very frequently asked question that name the 6 typical components of a synovial joint. What is a bursa? It is a sac of a serous membrane filled with serous fluid, and it is usually present between the two surfaces that are undergoing friction. It may be between the tendon and the muscle, it may be between the tendon and the bone, it may be between the muscle and the skin. And synovial sheath is basically a specialized type of bursa, and where the bursa wraps the tendon and it facilitates the to and fro movement of tendon in a confined. Let's see the exam questions. What are the characteristics of a synovial joint? List all the things. What are synovial fluid? Give its function. We discuss 3 functions. Name the synovial joints of the upper limbs. Almost all of the joints are synovial. Enlist intra-articular structures present in the synovial joint. Same question. What are the factors responsible for lubrication of synovial joint? In that you can give answer about the synovial fluid, synovial membrane, and the glistening surface of the hyaline cartilage that is present on the articulating cartilage that is present on top of the bone. Furthermore, you can give example of the intra-articular discs and cartilages which helps in or making the reciprocal surfaces more congruent. Meaning, for example, the tibia, here I will give you an example. Like tibia is relatively flat, but the femur is relatively round. So the disc is managing the both. So it is concave on the upper surface and it is flat on the lower surface. So it is also one of the very important structure that ensures that free movement, lubricated movement occurs between the joints. And list the characteristics of synovial joint. Classify synovial joints on architectural basis. You can do that. Classify joints. You can do that. This is a fancy way of asking the same question. Inserted arthroscope and list any strict structure that he can view and list all the components that you studied earlier. Classify synovial joint based on the shape. Same question. Strict structural feature. Same question. Describe the term bursa and synovial sheath. We discussed that what is the role of relation to trauma and infection. When trauma and infection, they usually tend to get inflamed, and when they get inflamed they swell up. In studying the gross anatomy, try to remember the names. You will study Baker's cyst, you will study clergyman's knee, you will study housemaid's knee. So these are when they inflamed, they get swelled and they appear as swelling on the surface and the movement is painful. What is nerve supply law of Hilton? Hilton's law. It is a simple that a sensory nerve supplying a joint also supplies the muscles moving the joint and the skin overlying the insertions of this muscle. So in simpler word, the muscles that are making a joint move, they have to be supplied by some nerves. So in other words, the nerves that move a joint also supply the joint. So this is the Hilton's law. It is frequently asked in UHS also. Factors affecting stability of a joint. Memorize these 5 points. Whenever this question is asked in relation to any particular joint in gross anatomy, write under these 5 headings. The shape and size of the articulating surfaces. For example, acetabulum and head of femur, they are very much congruent and they're very much covering one another. So they provide a stable connection like this. But at the same time, some plane joints are made like this. So which one is more stable? This one. The more the articulating surfaces are congruent with one another, the more stable they are. Then there are ligaments. You must be knowing the ligaments of a lot of joints. Elbow joint has two ligaments on each side. Knee has a lot of ligaments on each side inside the joint. Then there is muscle tone. A very good example is that of a shoulder. The deltoid, the biceps, the triceps, they are constantly picking up the humerus towards the socket of the scapula. They don't allow the shoulder joint to fall off. If these joints, if the deltoid becomes paralyzed, if the muscles of the upper limb becomes paralyzed, the joint is easily dislocated. The labra, we discussed that at the margin there is an extension of the glenoid cavity and acetabular cavity. There is an extension by the fibrocartilage, and this is known as labrum. And the posture of the joints. Some joints are more stable in a particular position as compared to some other position. For example, when the hips are flexed and adducted, they are more prone to get dislocated, just like a person hits and gets in a car accident while sitting on the seat. So these are the factors that affect the stability of a joint. You can use these for any of the joint whenever there is question asked about the stability. So here you can see that congruent surfaces are shown of the acetabulum, ligaments are shown, muscle tone are shown, intra-articular arches of the foot, they are maintained by a lot of ligaments. We can discuss that in cross anatomy. So enumerate and briefly describe the example from upper and lower limb, the key factors stabilizing the joints. We discussed them just now. Thank you so much. This is all about the joints of the upper limb. For more videos, follow our Facebook page, subscribe to our YouTube channel, and we are conducting a rapid review course for anatomy and physiology of first year. Register at the given link or contact us in the number and email given here. Thank you so much. Hope to see you again. Good night. Goodbye.